Hi, dear colleagues. Welcome to the NBEMS lecture number 3, which is focused on the types of clinical data that as physicians we should understand and what is the right question to ask. To take us through this journey, we have two eminent personalities, Professor Dr. Phanindra Yalavathi and Professor Dr. Anurag Agarwal. Both of us are going to take us through the types of clinical data and how to ensure that we ask the right question so that we don't stuck in the wrong place. So to give an introduction to our moderator, Professor Anurag Agarwal is a Dean Biosciences and Health Research in Trivedi School of Business, Biosciences, Ashoka University, India. He was the former director of the Institute of Genomics and Integrative Biology. It's a national laboratory of the CSIR India. He did his medical education at AIIMS Delhi and further got trained in the pulmonary diseases and critical care at Baylor College of Medicine. This was followed by PhD in the physiology from the Delhi University. And he is the winner of famous S.S. Bhatnagar Award, which is considered equivalent to Indian Nobel. And he is having keen interest in the AI. Welcome, Dr. Anurag. And I would like to introduce Dr. Phanindra also. He is a professor at IISc Bangalore, having a deep interest in the intersection of AI in medicine. He himself is the pioneer or one of the first persons to start training the people, especially the medical fraternity, on the artificial intelligence. Over to you, Dr. Phanindra, on what you're going to teach our doctors today. A short introduction will help us, sir.
Thank you, Dr. Suresh. I'm very glad and honored to be here. I would also like to thank Anurag for moderating this session as well. So just to start off, one of the fundamental reasons why this lecture is very, very important is rarely the medical data is what we call it as ready to use for AI use. So a lot of the medical data currently we produce is in a form what we call it as either unstructured, at best semi-structured. So how do we learn from such a data? This is the number one problem we have. Number two problem we have is that, so what we consider as a ground truth or annotation is also largely varying depending on the type of context you look at it, the type of question you are trying to answer as well. So in a very simple sense, the quality of the data depends on the question you are trying to answer. Typically, medical data, we put it into two buckets. One, we call it as episodic versus continuum. So if at all, for example, if you take the example of managing of diabetes, there the data collection has to be continuum. Whereas if you are really looking at somewhat like detection of diabetes, so then that we call it as very episodic, where you can do a simple test and then get it done. So this differences we should know from the modeling perspective. And as famously, I heard from Professor Anurag as well, where we say is that garbage in, gospel out.
Correct.
So if at all you are getting the data, and then if you don't have quality of the data, then you might get a gospel out, which might be simply garbage or which might say something else. So this way, it is very important to know these nuances of how does the learning or how does the AI sees it as a data. So that is where I will stop. Thank you.
Thank you, Dr. Phanindra. Over to you, Dr. Anurag. Why it is important to the doctors like us?
No, absolutely, Suresh. I think we're at a very interesting point in medicine where we are about to see where technology makes a massive impact on how medicine is practiced, learned, and in the future even taught. And this is about going to be so transformational that if we don't learn to use it well, we will end up going all kinds of wrong directions. See, it is difficult for a doctor to come to grips with the nuts and bolts of AI in terms of the maths behind it, the computer science behind it. We're not necessarily trained that way. But what we are trained for is what is the question worth answering? And what is the question that matters? And that knowledge often determines, the type of data we will collect, the type of answers we want. And I think us learning about this from the people with a computer science background and us communicating what is important to us as a field to make impact on the ground is both required side by side. And the fact that Phanindra has picked this topic to look at the types of data, how to address questions, I think is very valuable for doctor listeners.
Very eagerly waiting for the actual lecture, which is going to be scheduled the next Wednesday, that is between 4 p.m. to 5 p.m. Thank you. Eager to see both of you there. Thank you very much, sir.
Thank you very
Thanks
much.
for your time. Bye.
Thank you.
Look
Thank you.
forward. Bye.